Hello, everyone, and welcome to the Synopsis Summit events. My name is Pradeep Goel. I'm the CEO of Solve.Care, and I'm excited to be speaking to all of you who are here at the Synopsis Summit. We are very grateful for the opportunity to speak to all of you and to present. A lot of you are excited about and have heard about Web3, blockchain, zero knowledge, identity, DID, and many other technologies, and how much promise they represent to make our lives better. I'm going to talk to you specifically about what you can do today to apply these technologies in the real world to solve real problems in healthcare. So first introduction. I'm Pradeep Goel. I'm the CEO of a company called Solve.Care. And we are a healthcare platform. And our mission is to make it possible for patients and doctors and all other stakeholders to collaborate, communicate, and manage healthcare much more effectively. And most importantly, to give you and I, the patient and the patient's families, control over their healthcare. And we have built a platform that's truly global and open, and that allows both consumer and enterprise to design their own healthcare solutions. Something as simple as building a circle with your family to take care of mom, so we can all share in her healthcare needs and collaborate around her well-being, to being a big hospital system that wants to launch a more fair and equitable patient appointment system, or perhaps better prescription management, or hundreds of other potential use cases. Now, what we will talk about today is how is it possible for someone who doesn't know blockchain or Web3 technology to actually use this technology stack. So let's start with a simple scenario. Let's say that you live far from parents, which most of us do, and you get a call one afternoon that mom is not feeling well. And now you are in a position where you need to help her, but you are not there. And you suddenly realize that when mom gets sick, it's not just some simple phone call. You have to help her find a doctor. You have to talk to her insurance company. You have to get an appointment, manage the appointment, make sure mom takes the appointment, get her prescriptions filled, pay for the healthcare, and to schedule follow-ups and make sure that she's taking her medication on an ongoing basis. And that's just the beginning of this journey. So anytime we have to interact with the healthcare system, things get very complex very quickly. We have designed a paradigm, a building block, a decentralized app called Care Card. And a Care Card is something that will help everyone, whether it's the patient or the doctor, the pharmacy or the lab, specialty care provider or whoever, to interact with each other in a safe way. Think of it as a really, really, really powerful WhatsApp message, but it's not a random message. It's a structured message that can go from wallet to wallet. And it has all kinds of fundamental properties, such as cards can be linked together. They are built-in, cryptographically secured. Every card carries with it a certain breadcrumbs around consent as to who sent the card to whom and what they can do with it. And the cards can be made compliant with any healthcare regimen or regulation. Everything that happens between two wallets using a card is fully auditable. All cards can talk to each other, which creates a really powerful network of cards that are able to collaborate with each other. Cards can carry your identity or not, which means you can do zero knowledge transactions because the cards are immutable. Their identity does not need to be exposed, and many other things. Now, as a non-techie, you may say, why do I care? And as a non-techie, I would say to you that the cards are designed to protect your data and your identity and give you the best access to care. But as a technologist, I'm telling you that between a network of cards or a deck of cards that are connected to each other, you can solve any healthcare problem. When people say to me or to our company, well, what do you really focus on? Our answer is we are focused on changing the plumbing of healthcare. We are focused on building a new computing primitive similar to how web was invented, we are reinventing healthcare by bringing this core Lego block called Care Card, which is so powerful that when you connect them together, you can solve any issue. And what I'm going to do today, in the next 5-7 minutes, is to show you how to build cards, sync them, and launch powerful network of cards and journeys that really can address the problem of a hospital or the problem of a country, and eventually the problem of the whole humanity in terms of how to access better healthcare. So basically the idea is, and the power of the card is that using a product called Care Labs, you can design cards, link them, and launch them on the platform, and they become available in your Care wallet or in the doctor's Care wallet. And now these cards can be exchanged and they can talk to each other. And you can have a card for appointment or prescription or referral or bill or payment or information about healthcare or reminders about your appointment or reminder to fill your prescription. Whatever you want to do, you can design a card and send that card to the other wallets, and the two of you can interact using the cards back and forth till the problem is addressed. And multiple people can collaborate around the same card, or multiple cards can be built to achieve collaboration among many, many people. So let's do this. Instead of talking, let's actually take a look how it works, okay? So the process is very simple. You sign up for Care Labs, you go and author a new care protocol, you design cards and you link them to the protocol, you deploy them in the wallet and you see them working in the wallet. And if you don't like it, you change it. And the whole process can be done in a day or 2 days. And to put things in perspective, when I was running other large healthcare organizations before coming to Solve.Care and launching and building Solve.Care platform, I was responsible for building very, very powerful and complex healthcare systems, be it for bill and payment, be it for determining who you are and whether you are eligible for certain healthcare benefits, be it for chronic care management, be it for transportation subsidies, all kinds of very complex systems. And I oversaw billions of dollars in IT expense, literally. And what I noticed is that over and over again, we are building very complex user-unfriendly technology stacks on IBM or Oracle or Deloitte or KPMG, Accenture, Cognizant, whoever. And these systems take hundreds of millions of dollars to build, years to build. And by the time they even come out of the gate, they're already obsolete because the world has moved on, the needs have changed, COVID has come and gone, and the system that you were starting to build in 2020, you might launch it in 2025, but it's already way obsolete. And yes, the original budget was 100 million, you're already sitting at 300 million with change orders. This is how healthcare IT works. We waste $1 trillion a year in this kind of a madness. So this model that we are showing and we have built allows you to do what used to take a year in a week. And that's not an exaggeration. You can build very powerful networks in a week that in the traditional IT using Web2 methodology could take you a year. And instead of spending $3 million, you can do it for $30,000, sometimes $3,000, but nowhere close to the numbers that Web2 technology demands from you. And the process is fun. So the whole point of Web3 technology and blockchain applied to healthcare boils down to 3 sentences. You can do things that you could not do before. You can do things 10 times faster. You can do things 100 times cheaper. That's why it matters. So now let's take a look what it takes. You author a new protocol. This is an accelerated video of actually building a set of cards that are being built for the United States territory for certain roles, patient, doctor, provider. And you go into the lab, you choose different set of cards, you create their roles, you attach different objects to the card, iconography, tiles, and underneath the card is always a chain and an event ledger that allows you to connect all these cards into an immutable event ledger called the blockchain. And you can link the cards together into a journey. And the whole process, once you have learned how to use Care Labs, it could take you a day to build a journey. It could take you 2 days to build a journey. But what you are doing is you're leveraging the whole platform to literally build, let's say, an appointment card or a prescription card or a referral card. And you can link them to each other to create really, really powerful networks. that different people can use to collaborate. So here, within about 5 minutes of actual activity, somebody built a quick care network, launched it. The network gets published into what is called the Care Labs environment, and it has been published. And now you have this network running in the wallet. And maybe it took you $1,000 worth of consulting time. Maybe you did it all by yourself. But what you just witnessed 6 years ago, before Solve.Care was created, that would have been at least $100,000 journey between RFP, a request for proposal, vendor selection, vendor contracting, then requirement session, then design, then prototyping, then UI UX design. All that is done for you. You don't need to think about building a mobile app. You don't need to build any kind of a UI UX framework. Everything is done. You literally choose the card and you choose the tiles you want to put on the card. You assemble the cards into links and you're done. And this is what it looks like. The card is built, it appears in your wallet, and you can use the card. For example, this card has been filled and sent to the doctor's wallet, and the doctor can now see this network, play with this network, respond to your request for appointment, and all this interaction between patient and doctor requires only two things on both sides: a phone in the hands of the patient and a phone in the hands of the wallet of the doctor. Now, the doctor could be replaced by an office manager or by a nurse. It doesn't matter. All of that is built to your requirements. So this whole notion that healthcare IT should be complex, it should require hugely expensive IT vendors, that you should need some tech stack that costs millions of dollars to build. You should have Amazon Web Services account. All of that is gone. And that's why what I used to write a check for a few years ago for $1 million with Solve.Care platform, I would probably spend 1,000. Okay, if I'm a very inefficient company and I need to do a lot of things internally from an administrative point of view, I might spend $10,000, but there's no way I'm spending $1 million like I used to. And more importantly, I can get it done in a week with my own team or any number of independent vendors and contractors and community that Solve.Care has. And if I don't like it, I can have it changed within a day. Versus if I try to change an existing system at Blue Cross, it would be a multi-million-dollar, multi-year project that I would be betting my career on. So we have changed the world of healthcare upside down. And what this does not only lets you interact between two parties, we can interact with infinite number of parties. It's possible to create cards where when wallet A sends a card to wallet B and wallet B does something, wallet C is automatically notified. So for example, I can easily build a card where I send a card to my mom saying, how are you feeling today? And it's a thumbs up, thumbs down, okay? And she thumbs down me 3 days in a row. Automatically, I can configure the card to push a notification to her hospital or to her primary care physician or to a friend who lives nearby or a nurse or a care coordinator and say, mom's been feeling unwell for 3 days in a row. She's gave me a thumbs down. I'm notifying you, we should probably bring her in for a checkup. And that would trigger wallet C sending mom an appointment card saying, we are available tomorrow at 9 a.m. Do you want to come in? She answers that question. I get notified that mom's accepted an appointment tomorrow at on the 9 a.m. And I can send her an Uber prepaid card saying the Uber will be at your doorstep at 8 a.m. and I've already paid for it. That kind of collaboration is impossible in the current world. I can say that flat out can be done. With Care Wallet, it's just a matter of all three having the Care Wallet, all of us, and just simply having this card ecosystem move between wallets. And we believe that there is not a healthcare ecosystem, a healthcare regulatory environment, healthcare data management environment, HIPAA or GDPR, patient paid, employer paid, insurance paid, government paid healthcare system that we cannot automate and improve within weeks. Now, the point of all this is that as cards move between wallets, everybody is in sync, but they are all compliant. The cards don't allow you to make mistakes. If certain things are not allowed, certain people cannot see each other's cards, that's all baked into the protocol. The protocol is the blockchain-based logic of the card, which means that When I interact with a card, I'm not interacting with blind logic. I can have anybody look at the card's logic on the chain to say, what are you going to do with my data? Who built this card? Why did they send it to me? What does the card do? Who authored it? Who's published it? Who sponsored it? What's the use of my data? All that is there. So independent parties can authorize and certify that there is nothing bad that can happen. And this is important. Because the card logic is public, nobody's going to get cheated. Nobody's going to get their data stolen. Nobody's going to get their identity stolen. And nobody can do things that are illegal, because if they do, the logic itself is in the blockchain, and the logic can be verified and certified by independent physicians or communities. And the logic being immutable, nobody can change the logic and spoof your email address and things like that. So it's secure, it's encrypted, and it's public. So the objective here being what? The objective being that you as a consumer should be able to rethink the way you interact with healthcare. You as a physician should be able to redesign the way you conduct your practice and the way you talk to your patients and the way you take care of them. As a hospital, you should be able to do a lot simpler admission, discharge, record management, compliance, care coordination. As an insurance company, I should be able to understand what my policyholders really need and provide them preemptive care so they don't get sick. As a government agency, I can take care of all the elderly people in my country, or all the diabetic, or all the really poor, or I can make sure all the pregnant women have proper nutrition. There is not a use case that we cannot address, because in the end, it boils down to simply designing the journey that delivers the best results. So in a nutshell, you can do anything. You can build appointment system, admission management, authorization and referrals, which is a fancy word for saying getting permission from the insurance company to go see the doctor. Coordinate care between primary care, secondary care, tertiary care, specialty care, case management when you have long-running disease episodes, and claims and bills from the doctor to the insurance company, and bills from the doctor to the patient, clinical trials and medical research, getting consent and getting rid of all the paper documents that you have. And you will be surprised or not surprised to hear that most healthcare institutions have still warehouses full of paper claim documents where all it says is Pradeep has agreed to get care from the doctor and he has signed his life away. Those things are still going on. All of that gets fixed with the card-based system. And there are many other use cases. And if you're from the healthcare space, these terms will make sense to you. If you're not from healthcare, just understand this. Healthcare is complex, but unnecessarily so. Healthcare is expensive, but unnecessarily so. And we have built a platform that will fundamentally change healthcare country by country, city by city, region by region, hospital by hospital, because what we are doing today is not good for us and definitely not good for our kids and our grandkids. You can lay out cards in very big journeys. You can stack cards together to make really powerful journeys. So when you spread out the stack, it looks like this. Here we are presenting some plans and showing the details, allowing them to choose their dependents and actually pay for the benefit right there. This is a very complex process that you can do in 4 cards. You can probably build a whole journey in probably 4 hours. And to build this in the Web2 world would be a monumental exercise. This is another card deck. Here we are allowing patients to choose doctors. These are just examples. Here is a card deck where the patient is getting a bill from the doctor and is sharing that cost with the family member to collect the funds to pay the bill. Here is a journey where as soon as a doctor sends an appointment, family member pay for the transportation because grandma doesn't have a car, and send a prepaid Uber health card and automatic booking of the ride. Hundreds of use cases. Only your imagination and your needs constrain you. That's all you need. In a nutshell, we want to enable every single person, parent or patient, grandmother or granddaughter, physician or big IDN, integrated delivery network, or a big hospital system, a citizen or government, to be able to approach healthcare differently. And that's why we call ourselves the platform that will redefine healthcare and bring the future forward. The company, in a nutshell, is a very innovative and very, it's globally spread out. So Solve.Care has about 100 employees across the world. So we have offices and locations so that we are basically working round the clock. When US is sleeping, South Korea is working, and people in between all the time. We have a huge global community of very excited and engaged patients, doctors, developers, if you want to join us, please do. Find us on Telegram at Solve.Care. And we have, this slide is a little bit outdated. Now the Care Wallet is available in about 80 countries, and more countries are coming. So when you build a card, you can decide to publish it in one country or all countries in the world. So you can build regional cards, you can build global cards, and you can essentially decide which country can see which cards. So in a nutshell, we invite all of you to participate with us. The Solve.Care team is very much a combination of technology and healthcare and government policy. You can look us up on the web at www.solve.care. We have a very competent board that guides us. People from US government, people from insurance, from healthcare in Canada, healthcare in the US. So Solve.Care is not a blockchain project. We are a very serious organization that has used blockchain to revolutionize healthcare. With that said, I want to invite all of you to rethink healthcare the way it should be. You are no longer just a recipient of care. You are very much an active member of reimagining healthcare. And even if you don't want to build a card, you can certainly tell your doctor that they should be contracting with you using care cards. You can tell your employer that they should be managing employee benefits and wellness using care cards. You can tell your local representative or government representative that they should be redesigning the healthcare system to make it work better for you and your family using care cards. There is not a scenario that cannot be improved with this very innovative, highly secure transactional system called Care Platform built on care cards. I appreciate all of you taking the time. I very much appreciate you supporting the Synopsis Summit. And we welcome you to the Solve.Care community. And please reach out to us if we can help you solve healthcare and improve healthcare in your life. Thank you very much.